Folliculitis is a common skin condition characterized by the inflammation or infection of hair follicles, the tiny pockets in the skin from which hair grows. Though typically a mild and self-limiting issue, folliculitis can cause discomfort, irritation, and cosmetic concerns. In severe cases, it may lead to more significant skin damage or recurrent infections. Understanding the causes, symptoms, types, and treatments of folliculitis is essential for effective prevention and management. What is folliculitis? Folliculitis occurs when hair follicles become inflamed due to an infection, irritation, or physical trauma. The condition can affect any part of the body that has hair, including the scalp, face, arms, back, buttocks, and legs. It appears as small red or white bumps around hair follicles and may be filled with pus. Folliculitis is not typically serious, but if left untreated or if it recurs frequently, it can lead to permanent hair loss or scarring. Causes of folliculitis. Folliculitis has multiple potential causes. Bacterial infection. The most common cause is Staphylococcus aureus, a bacterium that lives on the skin. If it enters hair follicles through cuts, shaving, or friction, it can lead to infection. Fungal infection. Fungi, such as Malassezia or Candida, can cause folliculitis, especially in warm and humid environments. Viral infections. In rare cases, viruses like herpes simplex can affect the hair follicles. Parasitic infestation. Mites like Demodex folliculorum can contribute to folliculitis. Irritation from shaving or tight clothing. Mechanical irritation from shaving, waxing, or friction from tight clothes can damage hair follicles and make them prone to infection. Hot tubs and swimming pools. Poorly maintained hot tubs and pools can harbor Pseudomonas aeruginosa, which causes hot tub folliculitis. Occlusion and sweating. Wearing non-breathable clothing or heavy creams can clog pores and follicles, promoting inflammation. Types of folliculitis. There are several types of folliculitis, based on the cause and clinical features. Bacterial folliculitis, usually caused by Staphylococcus aureus, this type presents as red bumps or pustules. Hot tub folliculitis, caused by Pseudomonas aeruginosa, it commonly appears after soaking in contaminated hot tubs. Pityrosporum folliculitis, a fungal type of folliculitis caused by yeast, often seen on the upper back, chest, and shoulders. Gram-negative folliculitis, occurs in patients on long-term antibiotics for acne, allowing gram-negative bacteria to proliferate. Eosinophilic folliculitis, often seen in people with weakened immune systems, such as those with HIV/AIDS. It causes intense itching and recurrent lesions. Pseudofolliculitis barbae, common in people who shave, particularly men with curly hair. It occurs when hairs grow back into the skin, causing inflammation. Symptoms of folliculitis. Symptoms can vary depending on the type and severity, but typically include red, inflamed bumps around hair follicles. Pus-filled blisters that may burst and crust over. Itching or burning sensation. Pain or tenderness. Swelling. Scarring or dark spots in severe or chronic cases. Diagnosis. Folliculitis is often diagnosed based on clinical appearance. In some cases, doctors may take a swab for bacterial or fungal cultures. Use a biopsy to examine a sample under a microscope, in chronic or unclear cases. Perform blood tests if an underlying immune disorder is suspected. Treatment. Treatment depends on the cause and severity of the folliculitis. Mild cases, often clear up on their own with good hygiene and warm compresses. Topical antibiotics, mupirocin or clindamycin creams may be prescribed for bacterial infections. Oral antibiotics, used in widespread or resistant bacterial folliculitis. Antifungal creams or pills, prescribed for fungal folliculitis, such as ketoconazole or fluconazole. Antiviral medications, if a viral infection like herpes is the cause. Avoiding irritants, discontinuing shaving or switching to electric razors can help. Laser hair removal, may be considered for recurrent cases, especially pseudofolliculitis barbae. Prevention. Preventing folliculitis involves minimizing risk factors. Keep skin clean and dry. Avoid tight or non-breathable clothing. Use clean razors and shave in the direction of hair growth. Avoid sharing personal items like towels or razors. Shower after sweating or swimming. Avoid hot tubs and pools that aren't properly maintained. Complications. Though often benign, folliculitis can lead to complications, including boils, furuncles, deeper infections in the hair follicle. Permanent hair loss, in cases of scarring folliculitis. Recurrent infections. Cellulitis, a potentially serious skin infection. Scarring and skin discoloration. Conclusion. Folliculitis is a common and usually manageable skin condition that can affect people of all ages and skin types. While mild cases may resolve with basic hygiene and care, more persistent or severe forms may require medical intervention. Identifying the type and cause of folliculitis is key to choosing the appropriate treatment and preventing recurrence. With proper skincare and awareness, most individuals can manage folliculitis effectively and maintain healthy skin.
Thank you for watching. Please subscribe our channel.